Starting, all attendees are in listen-only mode.
Good afternoon, everyone. Thank you for joining us for this month's Strengthening Families Networking webinar. My name is Kaylin O'Connor, and I will be getting us started here. Today, we're focusing on strengthening families through family, friend, and neighbor care providers, an important piece of the lives of many families with young children. So we'll talk about what we should think about when we're working with them and hear about some really innovative strategies in place in a few places. As usual, we'll start off today with some updates from my organization, the Center for the Study of Social Policy, and from the National Alliance of Children's Trust and Prevention Funds, and then we'll get into our main topic with our guest presenters. I always like to start with a couple words about these webinars in case it's your first time. These webinars are an open invitation to anyone who's using the Protective Factors Framework or implementing Strengthening Families in their program, their community, their state. Convened jointly by CSSP and by the National Alliance of Children's Trust Funds. And we have topics and guest speakers that are coordinated on a rotating basis. Today's topic was coordinated by Nina Cesar O'Donnell, who will be speaking in a few minutes. And I also just wanted to make sure that you're aware that the recordings and materials from these webinars are always posted on a Google site maintained by the Alliance. That link is there. It also goes out each month in the Strengthening Families e-update. A couple of webinar tips to get us started in case you're having any audio problems. The key thing is to make sure that the system knows which way you're trying to connect, whether you're listening through the speaker on your computer or on the phone. If you are on the phone, you need to enter your personalized audio PIN that will allow us to unmute you if you do want to speak. And there are a couple other tips there that hopefully you can look through. If you are having problems, type in a question and we'll try to help you, or the ultimate response is always to hang up and dial back in. That is often very effective. Okay, a quick snapshot of what we have coming up. We do this the second Thursday of each month. So coming up in January, we have a focus on how CASA volunteers are using the Protective Factors approach. Maureen Durning from Idaho is coordinating that one, and you can already register at the link that you see on your screen. I should mention we normally send out that registration link in a newsletter that goes out the last week of the month. December being December, we won't be sending that newsletter out as normal at the end of December, so you'll get a message in early January that won't be a full newsletter, but will remind you about this upcoming webinar. But in the meantime, you might just want to register now and not have to think about it again. In February, we'll hear about cafes. Most of you are probably familiar with parent cafes and community cafes. There's a new cafe model on the scene from 0 to 3 developed with folks in Minnesota, and it's designed to facilitate conversations between parents and service providers, early care and education providers and others. It's called Caring Conversations. So we'll hear about cafes in general and about this new model on February 11th. And then on March 10th, we're going to hear about strengthening families and how it relates to healthy marriage and relationship education. So some exciting topics coming up. You're always welcome to forward these invitations and information to other people who you think would be interested, who are partners you might want to connect with. And feel free to contact me if you have a webinar topic in mind that you'd like to present or volunteer to coordinate some other speakers about. We're lining those up for later in 2016 at this point. Okay, so I'm going to share just a couple updates of recent news from CSSP. Along with our partners at the Friends Resource Center for Community-Based Child Abuse Prevention and the National Network of Family Support and Strengthening Networks, we work together on a document, a guide to help programs and funders understand the array of self-assessment tools that are available for programs that are family support programs, family resource centers, and other community-based programs. So we go through the self-assessment tools that are available from each of our organizations and then talk about the purposes of program assessment, a summary of each of those tools. On the website at Friends there, where you see the link, there are some scenarios that describe how a board or a funder or a program director might make decisions about what tool to use in a given circumstance. So please take a look at that. The tool itself is actually available to download through this webinar. If you look at the handouts on your webinar panel, you can see selecting a family support and strengthening program assessment tool. So please download that, check it out, and share it. I know there's been some confusion in the field about all these different tools. They are all they're all great. They all reinforce a lot of the same ideas, but get at them in different ways and with different levels of specificity. So please take a look at that the next time you're thinking about which tool you might want to use. Another piece that you can grab from the handouts of this webinar or on our website is a document on making the link between Strengthening Families and Triple P. We've done a series of making the link fact sheets like this with different evidence-based programs so that you can see how implementation of Strengthening Families can go hand in hand with implementation of a particular evidence-based program. So this one is about Triple P. We're very excited to work with Triple P America to develop this. And many thanks to the Children's Trust of South Carolina, who helped to facilitate that connection, to help us realize that we were both interested in helping our implementers understand how the work was related. So please check that out. The link, I didn't put a direct link to it because it's very long and ugly, but if you go to our website and click on the practice section of the Strengthening Families website, and then aligning practice with Strengthening Families, you'll see all the Making the Link fact sheets. And I encourage you to check those out. We also have a new module in our scripted curriculum on Strengthening Families focused on community approaches to strengthening families. So this is a short module. It includes slides, a script, and one group activity to help a group work through ways that they might engage in some community level implementation of the Strengthening Families framework. That's the 6th out of 8 modules, so there are a couple more still to come in the new year, and we really hope that you are able to take those materials, incorporate them into other trainings, or just use them on their own. We put them out there for all of you to use after developing them with different jurisdictions that needed these particular topics, and we are happy to share them and hope that you will put them to good use. A couple more. These are more calls for interest. We are working on a really exciting project with the Prevention Institute, where we're working on strengthening the connections between early childhood work and community violence prevention work. I have a feeling that some of you are already doing this on the ground, and we would love to hear about what you're doing, how you're bringing those partners to the same tables, how you're using protective factors in community violence prevention work, or if you've already started talking about community protective factors, we'd love to hear about that. So please contact me if you have that information. We'll be doing some interviews and a survey probably of anybody who lets us know they're interested so that we can figure out what's already going on and what the best way forward would be. And one final update from CSSP. For those of you who work with expectant and parenting youth in foster care, which I know is an overlapping interest area with Strengthening Families, we invite you to join another group that's smaller and more focused on that particular topic. It's a learning collective of professionals who are supporting expectant and parenting youth and their children in the foster care system. They actually have a webinar coming up next week, which will feature a program called New Mexico Grads, including a couple participants in the program to talk about the difference it's made in their life, and the program director talking about how they do their work to support those young parents and their children. Please check that out if you are working with that population. And now I would like to ask my colleague Martha Reeder to share updates from the Alliance.
Good afternoon. It's good to be with all of you this afternoon. Kaylin, if we can go to the next slide. Just have a couple of quick updates from the Alliance today. The first one is about the Birth Parent National Network virtual convening, which was in November, and those webinars are now archived on our website at this link, and you can also find them under the far right tab on our website called Resources. And each one of these sessions, I just gave you the keynote speaker, but there are many other features in that 90 minutes, each 90-minute session. So Kristen Shook-Slack from University of Wisconsin-Madison in the session 1 talks about the prevention of child neglect. And then we get to hear from Dr. David Sanders in session 2. And in session 3, Martha Davis from the Robert Wood Johnson Foundation talks about a community of wellness, and there are really some wonderful contributions from parents during these calls about the ways that parents can help to lead reform in the child welfare system and the leadership roles they play, their advocacy roles they play, and they are making an incredible difference. So if you would like to review these webinars, this is a way you can do that if you missed them when they were going on. Can we go to the next slide? Just some information about, you can go ahead and click through this if you like, about our training of trainers around the Protective Factors Framework. And we have some upcoming trainings. We can go ahead and go to the next slide. Those, in fact, right now, a training is being conducted in Yakima, Washington, and I have a wonderful group of trainers there, and we have an upcoming training in Fresno, California, March 1 through 3, and then we'll be in the state of Utah in May. We have several others that we're negotiating, and some of them have some open enrollment slots, and I have a distribution list that you can go to our website under training opportunities if you would like to be added to the distribution list. You can be added there, and you would receive any notice of any opening available slots. We also have a training that's penciled into our calendar the middle week of March in Riverside County, California, one in Wisconsin in June. So there are going to be quite a few opportunities, and the Alliance last summer hosted an open training for those that might just have 3 or 4 or 1 or 2 people from different locations that are interested in participating. But we may consider doing that again this year, and if so, and you want to be aware of those things and be on our distribution list, please just put your name into the list there off of our website, and you'll be sure and receive all that information. So that's all I have to share today, and I'll be anxious to hear from you if you have any questions.
Thanks so much, Martha. All right.
You're welcome.
Well, Martha and I both rushed through our updates because we're so excited about the topic today, and we know that the presenters who are on the line have so much great information to share. So I'm going to hand this over to Nina Sazer O'Donnell, pictured here with her daughter a few years ago, in probably the most adorable picture we've ever included in one of these webinars. And Nina is a longtime partner for Strengthening Families, a friend of CSSP's, and has been doing great work through United Way and now in NSO Associates, her own consulting firm. And we are so thrilled that she continues to convene and provide guidance and just be a leader within the world of strengthening families. And we're happy that she's here with us today. Welcome, Nina.
Thank you, Kaylin, and hello, everyone. I know that there are a lot of wonderful friends on the line and friends I haven't met yet. And this webinar is on strengthening families through family, friend, and neighbor care providers, but it's also really strengthening family, friends, and neighbors resources and helping families, friends, and neighbors through strengthening families. So there was a conference about, gosh, I can't remember, maybe 6-8 years ago when Judy Langford and I were, maybe it was more than that, I can't remember, were invited to be keynote together for a group of early childhood funders, and we were told to be provocative, which if you know me and you know Judy, that was like a very exciting license. And so what we did was we took on what is still, unfortunately, a very challenging issue, which is the inclination of people in the formal professional child care world to want to license families and friends and neighbors who take care of children. And so we proposed that instead of thinking about that, licensing for this group of people in the world, that we ought to use the Strengthening Families Protective Factors as a framework. And it went over pretty well, and since then, the three presenters and I on the phone, who all are national leaders in this arena, have been spreading this idea because it totally makes sense. And what we've been trying to help people understand is that there's there's a continuum that starts with families and then family, friends, and coworkers and neighbors, and then there's a transition to professional licensed family childcare and licensed centers, and we've been trying to help the world understand that. So it's very exciting to us that we get to present to you. We're all going to talk really fast so we can try to save time for questions. So let's go. Let's go, Kaylin. What I'm going to do is I'm going to do a quick little overview of who, what, why, what, where with family, friends, and neighbors, and strategy, advice, and resources. This is based on probably 10, 12 years of research by many people around the country and experience by leaders who are doing extraordinary work who you will hear from shortly. Let's go. Next slide. So who are FFNs? These are just bullet points. I can give you more information later, but most are not reimbursed, even though a small percentage are, and in certain states more are, for example, in Michigan, but most are not. 2/3 are grandparents. Consistently, over time, 10% want to become licensed family child care providers, which is great, but not all of them. They want to learn, but not in formal settings. It's more comfortable. They don't want to go to community college. They want to learn at church or have something in the neighborhood. Very few get public subsidies. The ones that issue is the one that becomes very challenging with the child care community who think that they should be licensed if they get subsidies. So we'll come back to that issue. You'll hear more about that. They all do different things. Some do full day care, some do nighttime care when their parents, a lot of people who use will, we're going to go to the next slide, but many of the caregivers are also, you can move it along, many of the caregivers are also low-wage earning part-time employees with very changeable shifts, especially in retail, hospitality, food service, finance, the cleaning people that clean the buildings, and so they, even if they could afford and high-quality center-based or family child care was available, it's impossible given their lives. So who are the children in these settings? Most kids, the majority of babies are in these settings. A lot of preschool kids of low-wage earning shift workers, and a lot of kids that are in Head Start or pre-K or early elementary go before and after school. Next slide. Why do families choose or use this kind of care? I think a lot of you already know this, you know, because of their desire to continue a culture, a language, a set of values that their family has, because there isn't really good choices for affordable, accessible infant care and care for preschool kids and before and after school care, because of constantly changing work schedules and a lack of transportation. And in many, 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 many cases, because of the love that the family has for the baby or the grandparents have for the baby. When I did research with caregivers, I found stories of family strength in trying to keep someone in the family able to care for the baby. So next slide. So what do caregivers want and need? They want to learn about child development, but not in formal settings. They need the protective factors. Next slide, which I don't have to say what those are for you guys. A lot of people say, how do we find them? How do we reach them? Everybody's confounded by this. And what we've learned over the years is you find them where they play, so parks and movie theaters and malls and whatever, where they pray, faith communities. Many caregivers told us they don't want to go to community college, but they'd stay later after the church service to have a little learning group where they pay, so retail places, grocery stores, Target, all kinds of places like that, and where they get paid, their workplaces, because most are working, or they're taking care of kids who are working. Many of the grandparents are working, and so reaching them through work is a great thing to do. Surprises and opportunities. One of the things that we've observed over time is that when a center in a neighborhood, like a Head Start center, this happened in many neighborhoods in Hawaii, when a Head Start center kind of invited a neighborhood FFN to come to a field trip or come to a training, they developed a relationship. And then when the child that was being cared for by the FFN got to be 3, the parents decided they want to go to a preschool program. This is very typical. Parents say, when my kid's 3, I want them to learn about how to get along with other kids. And so the caregiver recommends the center up the street because they have a relationship and she knows them. So that's an unintended thing that's happened in a lot of places, and now is being done intentionally, especially in the Head Start system. Intermediaries work best. Paula's going to talk a lot about the way that they have equipped a really diverse array of intermediary organizations who connect with elders, with immigrants, not the typical early childhood folks, but they are given the information to share and the resources to share by the early childhood folks. A lot can be done by simply connecting the dots in communities. Some things need funding, certainly staffing time, because it's relationship-based work, but there are a lot of resources that can be pulled together to provide the protective factors for these folks, and many sectors should play across silos. They don't always, but that's part of the solution here. That's an opportunity. Next slide. So I wanted to also tell you about a very exciting new project and make sure that you guys are connecting where this is going on. And Diana's going to talk about how this evolved in Colorado, but Rocky Mountain Public Television is the mothership for a project that's being planned for 3 years that will involve 11 public television stations who have all agreed to use their production, digital, and outreach assets, all the things that they can do. They can produce, they call them interstitials, PSAs, they can do all kinds of information sharing with families, and a lot of them do outreach for families and friends and neighbors, which is very, very, very exciting. This is happening with a Corporation for Public Broadcasting planning grant right now, and then we're being midwifed by CPB for a 3-year project. And we had a meeting with all the stations, and I got to give them a little overview, and then I told them, you guys will appreciate this, I told them that the best framing for their work, for all the content of their work, is the protective factors. And they have agreed to that. They believed me. And so a lot of the work that they're going to be doing will be, the content will be framed by the protective factors, which is extremely exciting. And I put this slide up with the list of the stations so that those of you in these places, please get in touch with me later so we can make sure that you all are connected in if you're not already. I'm not sure a lot of them are working with early childhood coalitions. I'm not sure how many of them have plugged into Strengthening Families coalitions or work. The other thing that I wanted to share with you is some strategy advice, and I'll go through these and this was a list I made for the PBS stations, but one of the other things that we have suggested is that they work with United Ways and bring the Strengthening Families protective factors to the workplace. So sort of replicating what I told you about in the beginning, and it's very, very exciting. And I think I'm done, and I want to pass it off to Paula Steinke, who is, I probably didn't say enough about the exciting ahead of the curve work that has been going on in Seattle and Denver and San Antonio for a very, very long time, and you guys are so lucky that you're going to hear about some of these amazing things that are going on that have happened. And I'll close by saying that all of us are very happy to be contacted later about anything that we've said. Okay, Paula, you're on.
Hello, everybody. I'm on, and I've never been introduced. I've never followed I Stink before, so that's new for me. We wanted to start talking about language matters. Nina and I and some others have really been talking about this. The construct of family, friend, and neighbor can be challenging when working, as I do, out of the child care resource and referral system, which focuses on child care providers, on licensure, and in some instances the friend and the neighbor care does have regulatory components to it. So emphasizing the family and really reframing, I'm working on a lot of collective impact initiatives, and there is a huge amount of interest in family engagement. And so I have really found, I mean, since we are serving the whole family and all of a child's caregivers, that reframing family, friend, and neighbor as family engagement in early learning makes a lot of sense. And I put up that ecological model here because just to remind us that we do know that children live in families and neighborhoods and in communities. So we're always remembering the context that people are helping children, parents care for young children because of their relationship to the family, and how we think about caregivers and families influences the way we approach them and how we work with them. And of course, the asset-based language and approaches fit right in with the protective factor framework and family support principles. So next slide, please. We do have a theory of change. I wanted to precede it with this because some people roll their eyes when they hear the words theory of change, but we have found it actually to be very effective. And so our actual theory of change is long and complicated, but this is what it comes down to, is to really, there's an extensive body of work, of research out there that links adult outcomes to child outcomes. And so, and then I was blessed to be able to attend the Harvard Family Engagement Institute this summer with one of my collective impact initiatives, the Roadmap Project. And Dr. Karen Mapp's work, she cites like 50 years of research linking, parent involvement and children's academic achievement and social development. So it just makes sense to me that FFN fits into this larger body of family engagement work. So we wanted to, next slide, we wanted to talk just about how we support all of a child's caregivers, and these are our goals here, and we again are thinking about the entire context of a child's life, which means we're working with older siblings who can become early learning ambassadors to their families and communities, especially siblings from immigrant and refugee communities. We have found that although the statistics about grandparents being the largest number of caregivers is those statistics are accurate in communities with a very high level of immigrant and refugee families. A lot of the times the elders are not there right now because of the circumstances that have brought the families here. So older siblings are definitely called upon to supply a lot of care. And then when elders are here, they may have lost status as holders of family traditions and wisdom. And so our approaches, because they're strength-based and respectful of culture and of inherent knowledge, they can support elders in regaining some of that status. And then when we're partnering with community organizations and with families over time, with different programs and in multiple venues, we actually are seeing change in community norms about parenting and child development and school readiness. Next slide, please. So there's always the quote-unquote hard-to-reach families. Next slide, please. Thank you. And so as Nina said, we work a lot with community-based organizations, and I've got the bullet list here, and we learn just constantly from our different organizations. There was back in the very early days when we were just starting our Play and Learn program, one of our partners, Chinese Information and Service Center, started a group specifically for grandparents, and they used our terminology, play and learn. And putting play and learn together made no sense to the grandparents that they were trying to reach, because at the time their services were really focused on elders. Now they've expanded to do a lot of early learning. And so they changed their labeling, and they called it Play School. And that brought people in. So it's not just about translating materials. It's really also about cultural interpretation. And this is where the community organizations that we work with are at their very best, because they understand the community. I wanted to comment. Nina mentioned simply connecting dots, and I absolutely agree with that. And it is simple, and at the same time it's complex because it's not a straight line. And people always ask, you know, it's just exactly, again, what Nina said about the relationship-based work that takes a lot of time in the front end of things to get to the outcomes you want at the end. So go ahead into the next slide. So that we've got common goals of our programs and partnerships are to be a gateway to information and services and resources, of course, to increase knowledge about child development, to help develop those positive social networks, and to provide participants with opportunities to grow. And our messages are delivered through coaching, modeling, peer conversations, referrals, resources, materials, and trainings. And this is a group of folks. It's a coffee shop there on the left, and one of our models, you can go to the next slide, is called Early Learning Conversations, and this is a very quick sample. There's topics related to child development with facts and with what you can do at home. Next slide, please. And then activities, and that is, of course, to honor all the different learning styles of the participants. And we work with parent leaders, and this was developed in response to requests from partners and parents about more accessible, more practical child development information. Next slide, please. And then the Brothers and Sisters program, I already mentioned that. This is just what the basic content is, and I wanted to show you we use a human-centered design approach in all of our program development, which is, you know, going to the community, asking questions, coming back, working on some materials, going back to the community in an iterative process. And so in this program, we were, go ahead to the next slide, we were just blessed to be able to work with a youth. He was a sophomore in high school, and he helped us as an intermediary to his peers. And in the first year, the kids asked for a graduation. I call them kids because I'm old. And they asked for a graduation, and these are the slides from their graduation project. And they invited parents, they invited teachers, and this was actually the PowerPoint that they did. And it was such a lovely component of the program that we've now included the graduation in the curriculum. And so the last 4 sessions, the youth work on a graduation, which of course helps them own the learning. And then finally, we do have our Kaleidoscope Play and Learn program that you guys may have heard about. We've presented before. And again, those are facilitated play groups in communities where parents and caregivers really experience a learning lab about how children learn through relationships and activities. And I'm over time.
Thank you, Paula. You were 8 minutes, not 7, but that was great.
7, thank you.
So Casey Cox is maybe one of the first people in the country who's just gotten her doctorate with a study on family, friend, and neighbors. And Diana, who you're going to hear from, is finishing up her doctoral program. Casey is a superstar in San Antonio. I know a lot of you know about the fine work that's gone on there for years, and she's going to tell you about their efforts. Casey.
Thank you, Nina. That's a lot to follow, so hopefully I live up to that. I quickly wanted to mention a little bit about the research that I just completed because I think it helps to frame our conversation today and a little bit about what we know in San Antonio. So for my dissertation research, I really focused on looking at our current child care subsidy model, and I worked through a Delphi study with a panel of experts to see what it means to really align our subsidy system, but to be more inclusive. So we know that currently family, friend, and neighbor care and informal care network isn't typically thought of when we think of formalized child care and when we think of child care subsidies. So I really looked at what the framework could be like if it was more expansive and more inclusive to all families. So what really came from that was that there is a huge need still, as much as we think we're aligning and collaborating, that's still the #1 need for a large community like San Antonio. So lots of information came from it as far as quality and really making sure that families understand what it means to be in a quality child care setting. But really the #1 thing that came from everybody as far as my research was that alignment and collaboration are key to everything that we do. So I think that in terms of talking about FFN and informal child care networks, we need to always be inclusive. We don't need to just talk about it in a separate space. We know that if somebody's in a child care center, if somebody's in a school, they probably know somebody who is an FFN provider, and they may not know to call it that, but they have neighbors, they have family, they have friends that are probably in this setting. So we always need to be inclusive in every conversation to make sure we're adapting to all audiences, but we're also talking about taking care of kids as a whole, not just, here's a formal child care center, here's FFN, here's a school district. It needs to be one collective conversation so we make sure that kids are a priority. If you'll go to the first slide, please. So this is what we started working on this past year in San Antonio. We really thought through, there are a million groups that are working on early childhood. There's a ton of groups working on child abuse prevention. There's a lot going on in San Antonio, but it wasn't fully aligned. So we thought, what if we really strengthen and align our early childhood systems to make sure that we're meeting all these needs of children and families? We're doing great work, here and there and in little parts, but we weren't really talking as a whole. So if you'll go to the next slide, please. So we created Ready Kid SA. Ready Kid SA, here's the formal definition, but what we really call it is a coalition of coalitions. It's really bringing together all of these groups that we're meeting under all of these different areas in early childhood, which we focus on 0 to 8, to really make sure we're connecting families and ensuring that kids all over San Antonio and Bexar County are on track for developmental milestones as far as social, emotional, physical, and cognitive, and to really all get on the same page. So once Ready Kid SA was created, we moved forward with what do we want this structure to look like? And we worked with some providers out of California, out of UCLA, and really used some of the framework that the city of Pasadena had just used to create these 8 building blocks. We got with 200 partners and we said, what does it look like to not only align all of our early childhood efforts and systems, but what do we want to see come out of it, and what are the major things that families and providers and kiddos are looking for? And so you'll see the first 3 on our 8 building blocks are really focusing on that collaborative piece, aligning systems, collaboration, data collection, which I was thrilled because this came out before my dissertation research, so I was just glad that everything backed up everything else once that happened. But you'll see the next 5 are really focused on certain areas in early childhood and family well-being. So we have, health in there. There's child welfare for that child abuse prevention piece and intervention piece. There's high-quality early education, neighborhood-based engagement, parent engagement, which is really where a lot of that FFN support fits in. And then the key that we miss often is the 8th building block, that transition. So it's one thing to work with these early providers, but if you're missing that transition from the early provider to when they enter the school system, that's a huge gap and a huge need that we weren't talking across systems with the school districts and the early providers and getting everybody on the same page, so that parents were having an easier transition, the kids were having an easier transition, and all providers kind of knew what to expect. So we are moving forward to those 8 building blocks. We're excited to say we're still in kind of the infancy phase because we are only a year in. So we're trying to see what this looks like for all of San Antonio, but we're really excited to see that a lot of other partners are starting to fill in the gaps of 8 building blocks. So we're starting to see who's missing around the table, who really needs to be involved in these conversations. We're starting to see what work can be amplified because maybe a couple of people are working on similar things. We never want to duplicate efforts, things like that. And then finally, I'll just mention a little bit about our Promise Neighborhood work. So we were fortunate to have one of the first rounds of the Promise Neighborhood grants in our east side of San Antonio. And in that same neighborhood, we also have the Choice Neighborhood grant that came out of HUD. We have some Annie Casey dollars to work on dual gen and a bunch of other little pieces that all came together in a really positive way for this neighborhood. But going out and really looking at early childhood was the #1 need for this neighborhood. So that was the #1 thing that was funded from the Promise Neighborhood Grant, and that was the #1 goal kind of for all of us as providers, but also for the neighborhood to really see that ramped up. So we went in year 1 and we thought, you know what we'll do? We'll buy some pre-K slots and we'll buy some child care slots, and we'll make sure that all of these kiddos are in a formalized structure and they're going to pre-K and child care. And I'm sure all of you know and are laughing right now that that's not really the best approach. So we went in thinking that moving everybody to formalized care would be great because we would know that they were getting a quality education that we could monitor and then going to the school system. Well, the neighborhood pretty much laughed at us right off the bat and said, we don't think so. A lot of them were really all about FFN care and all about that informal structure, whether it was due to the fact that they had trust in that provider or they were working a little bit odd hours. They were working maybe in hotel or retail or something that didn't work with the 8 to 5 or 8 to 6. Typical frame. So they really moved forward and thought, what can we do? So now we are focusing really on our informal child care networks. We're focusing on talking to neighborhood providers. We're talking to really see what it takes to bring out these less tapped into providers and parents and friends that are in the neighborhood, to really see how we tap into them and make sure that they're getting the same training as Nina mentioned, but in a different approach. So we're really working with Nina closely to make sure that we're going in the best approach for families, to make sure that we're honoring the trust in the neighborhood, but we're also giving them the quality that's needed to make sure these kiddos are showing up to school on time. And I am out of time.
And you did great. Thank you, Casey. So now the third superstar, Diana Romero Campbell, who is the Director of Learning and Education at Mile High United Way, and she will tell you, done some really amazing things in Colorado. Diana.
Great, thank you, Nina, and amazing information, you guys. I just think it's so aligned, and especially when you go last, that's why my slides have a lot of color and a little bit of visual here. I wanted to talk to you a little bit about our Colorado FFN learning community, and this is a group that came together a number of years ago, and it was about 5 people around the table really saying, this is an issue in our community, in our state, and what do we do? We were able to do a report to the community looking at a snapshot of family, friend, and neighbor care within Colorado. That came out in March of 2013. We had a meeting bringing people together, so a small group. Our meeting grew to about 10 people, and then we said we need to really bring this report back to the broader community and have a discussion. That was about 3 years ago. Since then, we have had multiple people join the learning community from across the state. So at any given time, we have ebb and flow of about 30 individuals to 75 that attend a monthly family, friend, and neighbor learning community and have an even larger email list. But the idea was, how do we collectively come together to ensure that children in FFN care are thriving? So this has really been pulling together those nonprofit organizations, representatives from the state, representatives from health, mental health, and parent education, coming together and really thinking about how are they reaching family, friend, and neighbor care, what supports might they need, and how do we collaborate, because we're talking about the same families. So as you can see, we have a mission of this collective voice and goals to learn what works, make it happen, reach out, and then really serve as a hub to the broader FFN community. What we do know are, again, the themes that you've heard from the other presenters today is that, family, friend, and neighbor care is universal, that they provide a critical part in this continuum of education for children, and that it does take many different shapes and forms. And when this came out in Colorado, it was, I think, confirming to a lot of people who were working with families, but also an aha of, we really need to think differently about the care that's being provided and where children are being cared for during the day. The next page, or the next one is, this is the bear at our convention center. One of the things that really bubbled up and highlighted and has been a reoccurring theme is that family, friend, and neighbor caregivers and children in that care are not targeted specifically for resources or information. Nina mentioned earlier the relationship that we have with Rocky Mountain PBS. They have been an amazing partner, and a few years ago there was a lovely person, Lori, who came and said, hey, I heard that you guys are working with Family, Friend, and Neighbor Care. We sat down and had a meeting that turned into a couple of hours of, wait a minute, we're talking about the same families we are interested in reaching, and what can we do? And out of that came an idea to say, how do we use Rocky Mountain PBS to really target the messages and then refer and connect families to those resources and to a centralized spot. So we are in the middle of, actually in the beginning of a project of creating those interstitials, those commercials, those what do we call them?
PSAs.
The PSAs, thank you. The PSAs that are very targeted in using language and saying, if you're caring for children, let's connect. And we have them connecting back to a nonprofit organization that provides online text message information for children from 0 to 3. This is a start, and I think it's a fantastic start that we have in Colorado. And so this links back to that broader set of work that Nina is doing across the country with other PBS stations. We are thrilled and excited to be a part of that. So next slide is, well, you know, we also know, and again, these are the same themes that you've been hearing, but that partnerships are key, access is key, and community building is key. So real quick, I want to talk about the Early Childhood Colorado Framework. So in 2015, this was led by the state and our Early Childhood Leadership Commission to revise the existing framework that we have with a new framework that has evolved over time, and it really had a ton of community input and support, and has provided this opportunity to use the framework to spur community conversation and collaborative strategies that we are really talking about increasing quality, access, and equity of services. So through the learning community, our monthly meetings, and this has been over the past couple of months, we took the framework and we really went through and said, how do we see FFN represented, and how do we use the framework and really start to reflect the work of the variety of organizations that are interested. So if you go to the next page, this is the Early Childhood Colorado framework with the little shoes on it. You could actually, it's a little bit blurry, so you could actually find this online at earlychildhoodframework.org, so if you want to take a closer look. But the next page, you can see this outline of strategies for action, fundamentals, and then again going to what is the access, quality, equity, and it aligns nicely, Paula, with the work that you've been talking about, as well as with the, you know, with looking at social ecology of how individuals and families and communities are interconnected. So if you go to the next slide, it's a sample, and it's our role of FFN in the Early Childhood Colorado Framework, and it's a working draft, so you can tell this is last month's version of it. But we really went through and put our mission in and went through the framework, and we're very strategic about what does that mean for Colorado within the community strategic engagement, and then for continuum of supports. And I'd like to highlight this piece in particular because in the continuum of supports, we talk about FFN supports the strengthening families' protective factors to ensure that all children are healthy, supported, and thriving. And I think that embedding that language, like you've heard from the other presenters and from Nina, that this is really something that we feel is a strong way for us to continue to engage with the variety of partners at the table. A little bit about this this slide and the next one. If you look at the boxes on the right, we went through an exercise with the broader learning community to say, how does your organization participate? Where do you fit? Where could you fit? Where would you like to fit? And be specific. And so everyone around the table basically took this form and took time to fill it out and to discuss it in small groups. And then we've also posted it in our notes for others who were unable to attend to reflect the work that they're doing. And then we had a spot also for, you know, for people to put down their name and their organization and for us to be able to follow up. But again, this kind of continuous conversation and constantly thinking about how do we frame FFN within a broader system, and what are people doing, how do we acknowledge it, and then move that issue and idea forward in our state. And that's all I've got.
Thank you, Diana.
I'm out of time, so I was going really fast.
Perfect. You guys, all three of you were terrific. And so I think now we're open for questions.
So this is Kaylin. We did have one question typed in already. I just want to take a moment to encourage others. You can type a question in the question box, or you can raise your hand in the webinar panel and we will unmute you and you can ask your question verbally. But in the meantime, while we wait for others to type and raise their hands, I will read the question that was written in by Elena Trueworthy. She wrote, for all those who are working with multiple groups and stakeholders, have you been able to establish common indicators and or common measures that everyone is working towards? Who wants
to take that one?
Can I say something real quick? This is Diana. I don't think we're there yet. I think that going through the framework is helping us start to frame it and acknowledging it and naming it. because we weren't naming it previously. So I think that we're at the beginning stages of moving towards that direction. But it's definitely where we want to go.
This is Nina. I'm very excited by a lot of the new assessment and evaluation tools because I think that they will be very useful. And in fact, we're going to be sort of going through them and figuring out how they can be used in San Antonio next week. And Paula, do you have any experience with that?
My comment would be we have in Washington State now we have a WAKIBS, it's Washington Kindergarten Inventory of Developing Skills, which is an observational assessment conducted in kindergarten and then in some instances in early learning. And it is not yet, it hasn't at the point yet where we can use it, but my hope is that if we can get enough programs to scale in a given community that then over time we would start to see school readiness indicators rise, because that's how we're framing all of this as a school readiness tool, but we haven't actually done that yet. What the inventory has done though is definitely increased the awareness throughout the world of P3 as to how many kids are in family-friendly neighbor care.
And this.
The other thing, I did want to make just another comment around equity. Diana said this, and I cannot emphasize enough that my agreement with her that this is an issue. Family Friendly Neighbor is all about equitable access to early learning supports and resources.
Yes, I totally agree with that as well. This is Kaylin. I wanted to also add on the question about measurement. That's something that we're working a lot on at CSSP these days with our group that's called the Early Childhood Learning and Innovation Network for Communities. So we have 9 communities we're working with closely on this question of shared measurement and what are the common outcomes and indicators. So stay tuned for more on that. I don't have anything we can share just yet, but just so you know, it's something we are focused on as well.
And at a community level, this is Nina again, all last year a group of organizations, including CSSP, worked together on a review draft that's actually online at resultsinequity.org on a set of indicators for communities to use across multiple initiatives. And we started with the revised pathways, 5 core results, and then for each of those results in this draft, and we would love you guys to review it actually, but for each of the core results there are 1 to 3 indicators that also CSSP fortunately had done some work with Child Trends, and we were able to use that research. And so each indicator has a definition, a research, sort of the research significance, and is ranked for communication, data, and proxy power. And honestly, the hardest ones to come up with were the measures of family strength. And we were doing this work before all of the wonderful new tools were out, so that's another thing for you to know about. Other questions?
We did have another question typed in from Tanetta Oliver asking, what have been the best practices used to get families engaged? I'm sure you all have a couple things you can share there, but who wants to jump in?
Well, I can start. This is Paula. Like I said, working in communities, not inviting people to your programs, but bringing programs out to community, asking community, by which I mean parents, other caregivers, students, community organizations, asking what the needs are, and then developing your materials and programs really with that in mind, and then checking back with the community about how did we do? Is this meeting your needs? And continuing to build that virtuous circle and having partnerships, and then just partnerships in the community and taking time to build relationships and also time to stick around.
This is Nina, and I have observing all these 3 presenters and others, that that if you take off your professional hat and think about this as a parent, and then approach parents with authentic respect, it seems like such a simple concept, but if you truly respect parents' knowledge and caregivers' knowledge, and you think about their lives and where they are and how you can connect with where they are in ways that are not adding stress or craziness to their lives. So that's why, back to where they pay, where they pray. I mean, everybody has to go grocery shopping. So if you can bring resources and information to parents while they're shopping, or something that actually helps them with their kids at 5 o'clock because it's a book or whatever, then that's a place and an opportunity. If there are examples of places that have, in Atlanta, where the National Black Child Development Institute joined the Ecumenical Council, and then as a peer and as a member of that group was able to help many different faith leaders across many different faiths begin to integrate child development and family support, family strengthening kinds of things into their work. So but it takes time, and that's something that a lot of the funding that funds all of our work doesn't give us enough of, because as everybody said, it's the relationships, not only the relationships with the community organizations, but also the relationships with other sectors where dots are not connecting. And then sharing the philosophy of strengthening families with all those other institutional partners who may not be approaching families in a very respectful way.
You know, Nina, I couldn't agree with you more, and that's one of the things that we have also found with the FFN learning community, is that it's meeting people where they're at. And so really organizations are coming to the table saying, I'm not working with family, friend, and neighbor caregivers. How do I do that? And you know, exactly the question that was posed, how are they reaching out into the community? And then you have others at the table who are doing really deep work, specifically with family, friend, and neighbors through play and learns and extensive training. And I think that it's without judgment. Come to the table, ask the questions, and it's a safe place to be able to talk about what strategies are working, how can they improve, how do those organizations, because it's at an organizational level that we're pulling the learning community together, but it's how do those organizations use each other as peer support to be able to
really
have the best strategies and refer.
Sorry to step on you. Yeah, and it's thinking about this in terms not of professional development. It's just an ineffective framework for these folks. It's around family support, education, and community
How
building.
do you incorporate it? Yeah. I'm giving you a thumbs up. Yeah.
Other questions? Are there other questions?
I don't see any other questions on the topic being typed in. We've had several questions asking whether the PowerPoint slides will be available and whether the recording will be available to share with others. The answer is yes to both of those, and I'm always glad to get those indicators that people are engaged in the content, want to be able to share it with others or come back to it. So I will I'm going to jump through some slides here so I can once again show you the link where those things will be posted. Let's see, I'm just going to.
And all of us are very willing to have you get in touch and ask more questions, because we're very passionate.
You know, I noticed that my email isn't on there, so we'll just make sure that we put it on for the one, I guess, that gets posted, but it's diana.romero-campbell@unitedwaydenver.org. I apologize, that's my fault.
And Diana, if you could type your email into the chat box that you should be able to see as a presenter, if you type it in there and have it sent to all, then everyone will be able to see it. That would be fantastic. Oh, Trish just did it. You don't even have to. Thank you, Trish.
Good. And then, so should I give you my number as well? Okay. I'll give you my phone number, 720-382-0007.
Thank you so much. And everyone should be able to see on screen right now the web address for the Google site where the Alliance posts the recording and the PowerPoint slides and the handouts from today. And we will also, since you registered for the webinar, and even if you register and miss it, you get a follow-up email tomorrow, approximately 24 hours from now, and that will give you a link to the recording itself. The slides will be posted on this other site along with the recording. So that's your more one-stop shop, but GoToWebinar will automatically give you the link to the recording itself. So I hope that is helpful.
Caitlin, I would just like to thank you and CSSP and the Alliance for inviting us to do this webinar. Thank you.
Oh, this has been fantastic. I'm so glad, and I have to say I'm so impressed that you all got through so much information in such a short time. I know any of you could have done an entire hour yourselves on the great work that you're doing, and I hope that people will reach out for more information, and we will check back in on all your great work at some later date. So thank you so much, Nina, for coordinating this, and Paula, Casey, and Diana for sharing your great information. I think it's been really helpful. So with that, thank you everyone, and we will release you back to the rest of your day.
Thank you.
Thanks a
Bye.
lot.
Thank you.
Bye.